Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 13th lecture on systemic pathology. Today, day 2 of liver diseases. Dear audience, in day 1 of liver disease, I have told you about the hepatotrophic viruses and hepatitis caused by virus A. Today's topic is hepatitis caused by virus B. Hepatitis caused by virus B. Dear audience, this is the liver. Come to route of transmission of virus B that causes hepatitis. Route of transmission. Parenteral route of transmission. Transfusion. Blood products. Needle stick accident. Syringe of drug addicts. So, parenteral route of transmission, transfusion, blood products, needle stick accident, syringe of drug addicts. Other route of transmission, saliva, semen, vaginal secretions. So, these are the route of transmission of virus B. Dear audience, now come to types of hepatitis caused by virus B. Acute hepatitis, chronic hepatitis. Dear audience, presence of infection in 6 months after first exposure to hepatitis B virus is known as chronic hepatitis. Presence of infection in 6 months after initial exposure to virus B is known as chronic hepatitis. Again, presence of infection in 6 months after initial exposure to virus B is known as chronic hepatitis. One is acute hepatitis, another is chronic hepatitis. Asymptomatic carrier state. asymptomatic carrier state, fulminant hepatitis with massive hepatic necrosis. Fulminant hepatitis with massive hepatic necrosis. These are the different types of hepatitis caused by virus B. There is asymptomatic carrier state. We know carrier is the individual who harbors the organism with a bit symptoms or with no symptoms. And this carrier may be healthy carrier and chronic carrier. In case of healthy carrier, there may be no symptoms or there may be little symptoms. But in case of chronic carrier, there is little symptoms. Dear audience, now come to morphology of liver in hepatitis caused by virus B. Cross examination reveals enlarged liver. Why liver is enlarged in hepatitis caused by virus B? Because it is an acute inflammation caused by virus B, and in acute inflammation there is swelling due to exudates, and as there is swelling there is enlargement of the liver. Dear audience, now come to histopathology. Histopathology reveals liver cell injury, isolated liver cell necrosis or necrosis of clusters of hepatocytes. Isolated hepatocyte necrosis or necrosis of clusters of hepatocyte. Reactive changes of Kupffer cells and sinusoidal cells. Reactive changes of Kupffer cell and sinusoidal cells. Infiltration of acute inflammatory cells. So, histopathology reveals liver cell injury, isolated hepatocyte necrosis or necrosis of clusters of hepatocytes, reactive changes of Kupffer cells and sinusoidal changes, and infiltration of acute inflammatory cells. Dear audience, if this is the central vein of the hepatic lobule, and if these are the hepatocytes, either isolated cells show necrosis or clusters of hepatocytes may show necrosis. This is the histopathology of liver in hepatitis caused by virus B. Dear audience, now come to laboratory diagnosis of hepatitis caused by virus B. Biochemical test, prothrombin time, serological test. First come to biochemical test. Serum bilirubin, serum bilirubin is elevated, that is, there is hyperbilirubinemia. Dear audience, as the hepatocyte is injured, there is disturbances in conjugation of bilirubin, so there is hyperbilirubinemia. Serum bilirubin is elevated. Serum ALT is elevated. Dear audience, as there is liver cell injury, there is elevation of ALT. Prothrombin time, prothrombin time is increased. Why prothrombin time is increased in hepatitis caused by virus B? Dear audience, we know from the liver prothrombin is synthesized, and for synthesis of prothrombin vitamin K is needed. As liver cell is injured, there is decreased synthesis of prothrombin. As there is decreased synthesis of prothrombin by liver, so there is increased prothrombin time. Serological test. Detection of hepatitis B viral surface antigen. Detection of hepatitis B viral E antigen. First come to detection of hepatitis B surface antigen. Dear audience, it is surface antigen of virus B. This antigen appears before the appearance of symptoms. This antigen appears before the appearance of symptoms. This antigen is an indicator of active infection. Is an indicator of active infection, either acute infection or chronic infection. This antigen peaks when the disease is overt and then it declines. This antigen peaks when the disease is overt and then declines. Dear audience, it is a surface antigen of virus. This antigen appears before the onset of symptoms and it peaks when the disease is overt and then it declines. And this surface antigen is an indicator of active infection, either acute hepatitis or chronic hepatitis. Hepatitis E antigen. Dear audience, it is an integral part of core antigen of virus B. It is an integral part of core antigen HBcAg of hepatitis B virus. Again, it is an integral part of core antigen. It is an indicator of active viral replication. Dear audience, this HBeAg antigen is an indicator of active viral replication. It disappears before surface antigen, that is HBsAg, is cleared from blood. Again, dear audience, this HBe antigen disappears from the blood before the surface antigen is cleared from blood. Dear audience, again we can detect surface antigen HBsAg and we can detect HBeAg. Surface antigen appears before the onset of symptoms. It peaks when the disease is overt, then it declines. HBeAg is an integral part of core antigen. It is an indicator of viral replication, but surface antigen is an indicator of active infection, either acute or chronic. HBeAg disappears before the surface antigen is cleared from blood. Dear audience, now come to, if hepatitis E antigen persists, what it indicates? Persistent hepatitis E antigen, what indicates? Persistent hepatitis E antigen, what indicates? It indicates continued viral replication. One of the indication of persistent hepatitis E antigen, continued viral replication. it indicates continued infectivity and it indicates progression to chronic hepatitis. It indicates progression to chronic hepatitis. Again, persistent ASBEAG indicates continued viral replication, indicates continued infectivity, and it indicates progression to chronic hepatitis. Dear audience, now come to window period. Before going to discuss about window period, we want to recapitulate. If anybody is infected by virus B, we know before the onset of symptoms, there is appearance of surface antigen. That is appearance of ASBS-AG. And gradually the titer of ASBS-AG is increased. And after some time of infection, there is appearance of antibody, that is anti-ASBS-AG. Dear audience, suppose this is the first day of appearance of surface antigen and this is the second day of appearance, the third day of appearance of surface antigen. If it is the first day of appearance of surface antigen, we know the titer is gradually increased. So the titer is increasing and there is plateau and this is the decline phase. This is the antigen, surface antigen. After some days, there is appearance of anti-ASBS-AG. That is, after some days, there is appearance of antibody. Then the antibody titer is gradually increasing. Again, before the onset of symptoms, there is appearance of surface antigen and the titer is gradually increasing. After some days of infection, there is appearance of antibody and the antibody titer is increasing. And there is a period, this is the period, during which the antibody titer and antigen titer is equal. And during this period, neither the surface antigen nor the antibody is detectable. Because during this period, the antigen titer and antibody titer is equal. This period is known as window period. Again, the period during antigen titer and antibody titer is equal. And neither the surface antigen or antibody is detectable. This period is known as window period. This period is known as window period. Dear audience, again, during this period, the antibody titer and antigen titer, that is the titer of HBsAg and titer of anti-HBsAg is equal. And during this period, neither the HBsAg nor the anti-HBsAg is detectable. This is known as window period. And during this period, only the marker is hepatitis B E antigen. During this period, the only marker is hepatitis E antigen. This is window period. Dear audience, now come to complications of hepatitis caused by virus B. Complications are cirrhosis of liver, hepatocellular carcinoma. So the complications of hepatitis caused by virus B is cirrhosis of liver and hepatocellular carcinoma. Dear audience, today I have told you about the route of transmission of virus B. I have told the parenteral route, transfusion, blood products, syringe of drug addicts, needle stick accidents. Other route of transmission, saliva, semen, vaginal secretions. I have told you the hepatitis may be acute hepatitis, chronic hepatitis, fulminant hepatitis with hepatic necrosis, and there may be asymptomatic carrier state. I have told you after initial exposure, if the infection persists in 6 months, then it is called chronic hepatitis. I have told you the individual who harbors the infective agent with little symptoms or no symptoms is known as carriers. I have told you about the histopathology. There is liver cell injury, isolated hepatocyte necrosis or necrosis of clusters of hepatocyte with reactive change of Kupffer cells and sinusoidal cells, and there is acute inflammatory cell infiltration. I have told you laboratory diagnosis of hepatitis caused by virus B, biochemical test, serum bilirubin, ALT is elevated, prothrombin time is increased, and serological test. I have told you about the window period. During this period, surface antigen or antibody against the surface antigen is not detectable because the titer is equal. And during this period, the only marker is hepatitis E antigen. Dear audience, today up to this, thanks all.